Welcome once again, friend. Today we will be discussing a new topic in the field of ENT and myself, Dr. Naren Singh Chauhan. And the today's question is: in the given photograph, we have to identify the pathological condition which is marked by the green arrow. As we can see that in this diagram, the diagram of oral cavity has been shown involving the tongue, lower teeth, upper teeth, and a swollen uvula has been shown. This is the swollen uvula. So we have to identify what pathological condition has caused this swollen uvula inside the mouth, the isolated swollen uvula inside the mouth. So going to the next slide, which actually covers its answer. I know many of you might be knowing the correct answer. The disease, that is the isolated swelling of uvula, is known as Quincke's disease. What is this known as? Quincke's disease. This is the isolated angioedema of uvula. This is the isolated angioedema of uvula. Most reports of uvular edema are found after ear, nose and throat procedure. Okay. Most report which has been found after ear, nose and throat procedure are caused by trauma. And most common cause of trauma is by during intubation, trauma caused by the laryngoscopic blade. Caused by, if during intubation the anesthetist touches the laryngoscopic blade with the uvula again and again, and it get hit by the sharp edge of the laryngoscopic blade again and again, or it is compressed between the tube and the other structures, then it may leads to the isolated edema of uvula, that is called as the Quincke's disease. Going to the next slide. The most common cause are, one is the trauma, as we have already discussed. Second cause is the inhalational exposure. Inhalational exposure, most common agent is marijuana, and second one is the general anesthesia. General anesthesia means the drugs which are given most commonly during general anesthetic procedure. Now, third is the medication reaction. Most common medicines responsible are the angiotensin converter enzyme inhibitor, that is ACE inhibitors, used for as antihypertensive medications. Now, fourth common cause is the infection, and last is the hereditary angioedema as an isolated part of our edema of uvula. So, five causes are: one is the trauma, as we have already discussed; inhalational exposure either to the fumes of marijuana or general anesthetic drugs; medical reaction to angiotensin converting enzyme inhibitors, that are the antihypertensive drugs. Number 4 one is the infections, and number 5 is the hereditary angioedema. Now, what should be our plan of treatment if such a patient is? So, if we go to the next slide, the plan of management is that first of all, a intravenous line should be established and intubation equipment should be set up at the bedside, because the swelling may increase in size and it may totally or partially obstruct the airway. So, a intravenous line should be established for giving drugs as well as antibiotics, and intubation equipment should be kept set by bedside. Most commonly used drugs are epinephrine, diphenhydramine, and methylprednisolone. These drugs are most commonly used for the treatment purpose. Patients who do not respond to above medication may also then, if any patient is not responding to the above medication, we can think in the line of a patient might have a complement deficiency and should also receive plasminogen inhibitor E-aminocaproic acid. What? E-aminocaproic acid. EACA we study during our MBBS period. If anyone is not responding to either epinephrine, diphenhydramine, and methylprednisolone, then the patient might have a complement deficiency and should also receive plasminogen inhibitor, that is E-aminocaproic acid. So this is the treatment for this Quincke disease, and patient may need a emergency intubation and ventilatory support due to increasing level of edema in the uvular area. So this finishes our today's topic. If you like the video, kindly share and subscribe, and stay tuned for more such videos. Thank you.